She's a retired hospital night sister and no stranger to pain among her patients. But in retirement, Nina Pringle was suffering herself, with pain in her leg so acute at times that she could hardly walk.
We were on holiday and we were standing waiting for a bus, and I sat down, and when the bus came, we had to let it go because I couldn't walk. You know, I couldn't sort of put my foot to the ground. So basically it was really unbearable, and obviously I couldn't go on like that.
Then Nina became one of the first NHS patients in England to undergo pioneering surgery, performed by a team who specialise in fast-track knee and hip replacements. The operation was carried out at Hexham General Hospital, the reputation of which is growing around the country.
What I want to do is tell you about the fast-track joint replacement system, which some of you may have heard of.
I think probably when we started we may have been amongst the first in England. I think there's certainly increasing interest now, and there's quite a lot of units interested, and also, I mean, we've had several approaches from other hospitals to come and see our technique as well. So it's becoming increasingly popular, but I would still say represents only a minority of units using the technique at the moment.
And then pop them onto here, and then just tuck your leg in underneath. You feel all right?
Yep.
You feel well supported?
Well supported.
Okay.
Since it developed the service in 2008, the team has operated on patients aged from their mid-30s to early 90s, though the majority are around 70 to 75 years old.
And then operated leg out and hands down. Well done. Very good.
The Northumbria Healthcare NHS Foundation Trust, of which Hexham is a part, conducts about 1,500 fast-track joint replacements a year. This means patients can usually leave hospital within 2 days of their operation.
We seem to be very pleased with the outcome so far. Patients are certainly very happy with it, and they're getting away much quicker than they were, mainly because it just seems to be less of an insult to the patient to have the operation. They're just, it's less of a big deal. It's more like, you know, the Scandinavians say it's like getting a tyre changed or a brake part changed. So it's less of a procedure.
The Northumbria Trust is now admitting patients from well outside of its own area, one benefit of the new NHS. That means people can choose where they're treated. Mary has an ambition to go dancing once she's fully recovered. That may take some months yet, but in the meantime she's encouraged by Nina well into her own recovery.
I can do everything I did before my knee started to bother me, really. Don't have any real problems at all. So I don't need to worry about if I'm going anywhere. I used to worry thinking, oh, well, what if my knee locks and I can't do this? Now it's great because it just doesn't lock now, and it's just been very successful.
During May 2009, the Fast Track Joint Replacement Unit in the Northumbria NHS Foundation Trust area won this trophy at the North East Health and Social Care Awards. A fitting tribute to a medical team making lives better.